here's the settings. We've already just went over all this, right? But this is just kind of it in a nutshell. So when you get back, we got 2 categories. We got a metal sleeve and a sleeveless. So if you want to go sleeveless, which is what I do, we have to change that offset from 8 to 8.5 or longer based on the case. The guide tooth diameter has to be 5.1 like Chip was saying, but calibrated. So you got to print a couple of them and try them to figure out what diameter you like for your drills for actually the engagement between the drill and the guide.
But just to be clear, you want to calibrate the resin first that you're printing in on your printer.
So
before you do that step of figuring out which one works for you.
So actually calibrating through the printer, I mean, to be honest with you, like I've been skipping that a lot.
Really?
Yeah.
And just find whatever diameter works and then just move with it.
Yeah, calibration has been cumbersome and more difficult for me than I'd appreciate. But I have had some advantages. I do feel that Sprint Ray is, with software updates and resin improvements, calibration I've been finding is less of a need. So I don't know if you've noticed that, Ray, at all.
I just assumed I had to do that as a default.
She's like, no, you still got to calibrate. Yeah, so and that, because you could do it that way too. You could go calibrate, and then what happens is your prints can come out bigger or smaller based on 5.1. So you could do it that backwards that direction too. The guides are all 3.3 millimeters in thickness. You don't have to change that. That's just how thick they are. If you wanted them beefier, you can change it. The guide spacer is defaulted to 0.2. So that's like how much space is there between the tooth and the guide so that it snaps on. Because this is a hard, rigid material. And you can tweak that, because a lot of times what I find is I go to the mouth and it's too tight. You're trying to push it on, and I take it off and I take a burr and I just go, and I just kind of ream around in there and just kind of open up some of the undercuts and then snap it back onto the mouth, right? That's one approach. Or you could sit and you could crank it up in the software to leave more space. I tend just to leave things more default, so it's not too challenging to do. Please, please, please learn how to know when a guide is seated. When a guide is seated on the teeth all the way down, you should not see any space. Your eyes should not be able to perceive space between tooth and guide. If you push it on and you see a little space, that's how it's supposed to be. I think there's a little slot built into these. It's not seated all the way, which then you've lost the whole benefit of that guide. So these things visually should look fully seated. If you have space in there, you have to think why. And you got to take it off. Maybe it's impinging on tissue. Maybe you need to ream it around a little bit to get it to snap. But just know that there's not an acceptable level of space between tooth and guide.
It looked like on the animation on your previous slide that it sits on the bone. Is that right? You have to flap it and it's sitting all the way down on the bone, the guide?
Well, that's a good question. So when you're designing it in a edentulous space, you're going to have tissue, and it's just going to, this actually does make it look like it's going to the bone. That's what you're talking about, right?
Yeah.
I would say that's incorrect. Most of the time on an edentulous space, the software is going to take it right down to your scan, which is your tissue. So I think that's not correct. Yeah, that's a good question though, because that's incorrect.
One more thing to add about the seating of the guide. So be good at recognizing areas where the guide isn't fully on the tooth, because the software, when it makes these guides, it's making it from an undercut model. So the guide isn't going to snap on if all the undercuts are still there. So it's basically draping over the model, and the underside of the teeth, the lingual cavities and everything, that's going to be a gap all the time. So when I put the guide on and through the window, I see the incisal edges, there's no daylight peeking through. It's a pretty good bet that your guide is seated.
Yeah.
If on the buccal or lingual there's a little bit of a concavity on both sides, you should probably assume that your software made some cuts for the undercut and recognize it then.
Yeah. Yeah, that's a really good point, because teeth angle in here, right? And the software is not going to print plastic inside under an undercut. It's going to block that out by default. So yeah, so he brings up a point. You're looking at the incisal or occlusal aspect for space.
And when they go in, they kind of snap. They'll pop in pretty.
The patient's like, oh.
Yeah, you're like, wow.
See that.
Yeah, they're pretty good, right?
Yeah.
Usually they kind of drop.
Yeah.
Snap right in.
Yep. And like our print's tight, so when you get tight, it snaps on tight, right? And sometimes it's hard to pull off. So again, calibration and all that stuff, how you like your guides to fit, you can control spacer. I'd just suggest leaving it default for now.
Do you ever have guys that are tough to get out?
Oh, yeah.
Too tight?
Like cut them out?
A solution for that? I've already cut one, but I have full crowns off.
Oh, have you?
Yeah.
I
That's
had
a
some
good-
and with not sedated patients. It's like quite a bit of pressure toward
Yeah.
the this thing's stuck in my mouth.
Yeah.
Sometimes I just cut down the bit where it goes to the pillows, but I don't get a better way home.
That's what I do too.
Yeah, a lot of times they're pretty tight.
They're pretty
Yeah,
tight.
That's one of the things I've been trying to figure out.
Yeah.
I want it tight, but sometimes they're hard to get out of.
The crowns coming off is a real thing.
Yeah.
Yeah, they are. They're very tight. And so the only thing I would suggest is calibrate to your level, maybe increase the spacer a little bit going forward. And yes, a lot of times I default to, when it makes those embrasures on the buccal and the lingual for where the papilla are, I run a burr through there and wipe them all out so it's not engaging so much. I do that quite a bit on most of my cases. And then, when it's on, you may just default. If it's too tight, you default to increasing your spacer a little bit. And then, I've had to cut them off if I just shoved them on and then I can't get them off. And if I didn't want to pull anything off, I've had to cut through them and snap them.
One second, before that, he said the thing with the crowns, it's gonna happen to you. Keep the crown in the guide, because that's still an area of support. Because you don't want to take the crown out and then have the guide wobble if you made it a little bit too short or not. And also with the patient, at least what I tell them is, hey, it's a blessing it came off right now, because you have the zirconia crown, this BFM or whatever, we can't see through it on the X-ray, and these things should not come off with this minimal amount of pressure. And now we actually see hey, you should probably get this replaced. It's it also builds your practice a little bit too.
I was going to ask just to verify the fact that there isn't a lot of undercuts or the guide's not going to get caught. Do you print model as well along with it just to verify the fit?
You can for peace of mind, for sure.
But on a routine basis, you don't do it.
No,
you just print it. So when you say that you're checking it to see if there are undercuts to weave it out first, you're just doing it based off of just the curves that you see on the guide.
Exactly.
It auto detects the undercuts and makes the guide from there. But you can definitely print your jaw.
So software detects it and you just stick with that.
So
You choose the angle at which it detects.
I'll confess, I differ in this. Every one I've ever done, I print a model and I try my surgical guide on and off that model, make any adjustments I need to, make sure it's nice and passive.
There you go.
It's just a half of the way. It's a waste of $1 or $2 of resin.
Yeah.
But for me, it gives me great peace of mind.
Yeah.
If that surgical guide won't go on, I can see it's hitting up on where my flap's going to be.
Yeah.
I can relieve a little bit of that. But anyway, I always have a model printed
That's cool.
personally.